Hey everyone, and welcome back to another video. In today's video, I want to chat about a really common surgery, a total knee replacement. We'll take a look at what it is, reasons to get it, and some exercises for early rehabilitation that will help you on your journey. Timestamps are available below if you want to skip straight to the exercises. A total knee replacement is a joint replacement surgery that involves replacing the articular surfaces and the cartilage in between your tibia and your femur, or your shin bone and your thigh bone. It is quite a big surgery and often involves a lot of swelling and pain immediately afterwards. So knee replacement surgery is usually done due to severe osteoarthritis, where the joint space and the articular surfaces have worn down, causing pain with function. This might also involve bone spurs, which create irregularity along the joint line and can be a contributor to pain as well. Now, osteoarthritis can be due to age or loading, or a combination of both, and everyone has a different threshold for pain, and so whether or not you require surgery will be a decision made between your doctor and yourself, and also taking into account what your function is like. If you're at the stage where walking for any amount of time is quite painful, you might be looking at getting a joint replacement surgery to help with this. It is important to say that not everyone with osteoarthritis requires a total knee replacement, and most surgeons will often encourage anyone seeking a joint replacement surgery to see a physiotherapist first to see if treatment and exercise can help prevent or delay surgery. Even if surgery is required, it is important to see a physiotherapist to start a process called Prehab, where your range of motion and strength and function is optimized as much as possible before you have your surgery. This can help your recovery after surgery and make that process a lot smoother, especially if you have achieved a really good amount of range of motion or strength before surgery. And it will make it much easier to regain normal function earlier. You should expect that after surgery, your range of motion and strength will have decreased due to the surgery itself, and also the pain and swelling as a result of surgery afterwards. Let's move into the time post-surgery, where you start your rehabilitation process. Your biggest goal in the first 2 weeks would be to be able to walk without crutches. You may achieve this early on before the 2-week mark, or you might take the full 2 weeks to get there, but this will vary depending on your pre-surgery strength and function. And so to achieve this goal of being able to walk without crutches, there are some intermediate goals in between that you want to aim for in terms of your strength and range. With regards to your range, you want to get to at least 90 degrees of flexion or bending in the knee. This will make function a lot easier, sitting and standing a lot easier, and walking a lot easier as well. Along with this, you want to achieve getting your knee to as straight as possible, or as close to 0 degrees as possible. This will be quite necessary to have a normal walking pattern. And so let's discuss the first exercise that you'll be doing straight after surgery, probably even in the hospital itself. Heel slides is going to be the exercise of choice that most of you will get. And this is a really simple but effective exercise to start moving your knee and start getting some range back into it. Now, to do this, you can lie down in bed or sit in a chair to do it. The goal of the exercise is to bend and straighten your knee as much as possible. It is easier to do when you reduce the friction, and so wearing a sock or something similar to create less friction when you move your foot will help. And so lying down in bed, you want to slide your heel up towards your bottom as far as you can, bending your knee as much as you are able to within tolerance of your pain. After you have gone as far as you are able to tolerate in the bending, you want to straighten back down your knee as far as you can. If you have not quite reached 0 yet, this is also an opportunity for you to try and push that part of the range. Repeat the motion 10 times and try and do it every hour, especially if you are within the first week of your surgery. This will really help the knee get moving, and also each day you'll find it easier and easier to do, and easier to bend and straighten your knee. Once you have achieved 90 degrees of bending, this will make life a lot easier, as 90 degrees is the minimum amount of bend you need to do many things, such as sitting down on a chair, getting up, walking, or even placing your foot up on a step. Alongside the hill slides, a strengthening exercise that you can be doing early on in your rehabilitation would be quad and glute contractions. This can be done also in bed. It's really simple to do and can also be done straight after surgery. This involves lying down with your leg straight out in front of you. Have a small towel rolled up underneath just to prop up your knee slightly, just a little bit off 0 degrees. From there, you want to engage your quad and your glute muscles and try and straighten your leg back down onto the bed against the resistance of the small towel. You should feel some activation of your quad and glutes to do this. Now, oftentimes your quads will be a little bit inhibited from the surgery, and so you might not feel a very good activation of that muscle. You can place your hand on your knee, on the top of your kneecap, and think about trying to pull your kneecap up towards your hand, and this will try and help your brain activate your quads a lot more. It would be normal to feel a small amount of pain while doing this exercise due to the fact that you've just had surgery. And so you'll want to try to do this exercise for 4 to 5 times every day, especially within that first week after surgery. Another great exercise to do is to utilize an exercise bike if you have access to one, and this can help you really push your range and strength together on the same machine. Start with no resistance on the bike and adjust the seat to a height where you can try to do as close to a full revolution of the pedals as possible. If your knee does not have sufficient range to do a full revolution, you might need to start with 2 halves, whereby you create a semicircle with your foot one way and then backwards the other way, and try and push your knee up into as much bend as you can tolerate, and slowly work on building towards a full revolution. Aim to pedal for 10 to 15 minutes in one go with no resistance to start off with. As your knee regains more range and you start moving into the strength component of rehabilitation, you can actually use the same exercise bike to strengthen your quads and hamstrings and calves together by increasing the resistance setting on the bike. The shift towards strengthening will start at about 120 to 130 degrees of bend in the knee, and so once you've achieved this, start to implement some resistance when you do the bike. We're going to talk about an exercise that can help you start to improve your strength so that you can start walking up and down stairs more comfortably. And so to do this, you will need a step to begin with. Placing your foot on it, we're going to perform a forward lunge onto that step, placing as much weight as you can onto your knee, as much as you can tolerate before backing off. And so start by placing your operated leg onto the step and push forward and load your leg as much as you are able to. If you are able to, hold that position for a few seconds before bringing your weight back onto your back leg. Perform this for 10 repetitions, 3 sets, and this will help you start to develop some quad and hamstring strength that you'll need to be able to climb stairs. Our last exercise for this video will be a really functional one, and it's to practice sit to stand, which is a really functional exercise, especially after having a total knee replacement. At the beginning of your recovery, you might find it really hard to keep your weight even between your feet as you go to sit and stand, and as you get stronger, you should notice that this starts to balance back out so that you can do 50-50 between both feet. For this exercise, start seated and place your feet at a level in which it is comfortable for you to stand up while having some weight on the operated leg. You might find that your operated leg has to start slightly ahead of the non-operated leg, which is fine for the moment. Stand up and then slowly sit back down, keeping your feet in the same position. On the way down, really concentrate on using your muscles to control the movement so that you don't just flop back into the chair. As you get stronger, you might find that this is too easy, and so you can start placing your non-operated leg slightly forward to help bias your body to use the operated leg more so during the movement. These 5 exercises are all great exercises for early rehabilitation after having a total knee replacement. Some of them can even be used in your mid and late rehabilitation with some adjustment to challenge your strength or your range further. Remember, your goal immediately after surgery is to regain your range of motion, limit the pain and swelling, and increase your function to perform your daily activities. If you have had a total knee replacement, it is a great idea to go see a physiotherapist so that you can have treatment as well as exercise tailored to you and to help you get started on your journey of recovery. And that brings us to the end of this video on early rehabilitation exercises for total knee replacements. If you've enjoyed the video, please hit that like button. And if you'd like to see more videos that are catered for mid or late rehabilitation for total knee replacements, let me know down in the comments. Subscribe to the channel to see more videos on rehabilitation tips. Thank you so much for watching, and if you have enjoyed this video, maybe you'd like to check out this video next.